speakers, past district governor, Professor Tan, fellow returns, friends, and lifesavers. Today is more than just a celebration. It is a reminder of the extraordinary power we each hold in our hands. I stand here as a district governor for Rotary District 9104 and the chair of this historic 25th National Blood Donor Day. I'm inspired, energized, and deeply grateful. The theme for this afternoon's function: give blood, give hope, together we save lives. It's not simply a message, it is a mission. It tells us that hope is something we can create, that saving a life is something we can choose, and that every one of us, a background, age, or status, can be a hero. When you donate blood, you're not just giving a unit, you are giving a second chance. You're giving a child the chance to dream again, a mother the chance to go home to her family, and the patient the chance to see tomorrow. What better gift could we possibly give? As we all know, Rotary's heartbeat is service. And today, that heartbeat becomes literal, because the blood we celebrate today is life itself. As we mark 25 years of this national movement, I encourage each of us to amplify our impact. Let this anniversary challenge us to dream bigger, reach further, and inspire more people to step forward. Because when hope is shared, hope multiplies. Today, let us begin a fire of compassion that does not end when this program ends. Let us be the reason someone lives. Together we save lives, and together we can save the people. Welcome, and thank you all for being heroes of humanity.
Thank you, Madam Chair. Oh, please, let's give it better for her. Indeed, for our young ones who are with us, almost about, I'm also young. I didn't finish. I finished SHS, I can't remember, about 21 years ago. Somebody said to me, this is an opportunity, and what Nana said to borrow her words is not only a message, it is a mission. A couple of weeks ago, I happened to be at one of our tertiary institutions for a friend who had been knocked down on a Sunday afternoon by a video. She had to be rushed into theatre.
Others through voluntary blood donation. Your selfless act is a lifeline for mothers in childbirth, for children with severe anemia, for accident victims, and for patients who are undergoing critical surgeries. Every unit of blood donated is a beacon of hope and a testament of the power of solidarity. Globally, about 118 million blood donations are collected every year. Yet, less than 10% of the world's population donates blood annually. In high-income countries, the donation rate is 31 units per 1,000 people, while in low-income countries, it's only 5 units per 1,000 people. In Africa, the average is even lower, with some countries collecting fewer than 6 units per 1,000 population. This gap costs lives. In Ghana, as we have heard from previous speakers, the annual need is about 300,000 units, but collections remain below 200,000, leaving us with a shortfall of over 100,000 units. These numbers are not just statistics. They represent mothers. They represent mothers who are bleeding during childbirth. They represent children with sickle cell and disease. And they represent accident victims who may not survive because blood was not available when needed. WHO stands firmly with Ghana and the National Blood Service in advancing safe, sufficient, and sustainable blood supply systems in line with WHO's global strategy for blood safety, which calls on universal access to blood that is safe and blood products as an essential component of healthcare. The strategy emphasizes voluntary, non-remunerated blood donation as the cornerstone of safe and adequate blood supply. So as we launch the 2026 annual blood donation campaign, let us all reaffirm our shared commitment to make voluntary blood donation a culture, a responsibility, and a legacy of compassion across our communities. To every blood donor here today, we thank you for your courage and for your humanity. You are true heroes. And to those who have not yet donated blood, I urge you, take a step today. If just 1% of Ghana's population donated regularly, the country's annual blood needs would be covered. Your blood can be the difference between life and death for someone in need. So let us give blood, give hope, and together save lives. Thank you very much.
Honorable Deputy Minister for Health, Dr. Grace Ayemi-Sudanwa, Chairman and Board Members of the National Blood Service, our distinguished WHO Country Representative, Dr. Fiona Branca, distinguished members of Rotary Clubs of Accra and Accra Ridge, heads of schools and students, friends from the media, esteemed voluntary blood donors, invited guests, ladies and gentlemen, good afternoon. It's a profound honor to welcome you all to the commemoration of the 25th National Blood Donor Day and the launch of the 2026 Annual Blood Donation Campaign. Thank you for joining us despite your busy schedules. Your presence speaks to your commitment to this life-saving cause. National Blood Donor Day remains one of the most important events on the calendar of the National Blood Service. It offers us the opportunity to celebrate and honor all voluntary and paid blood donors whose selfless contribution provides the most precious gift of all, the gift of life. It is also a moment to acknowledge our partners and stakeholders whose continuous support strengthens Ghana's blood donation program. Beyond celebrations, today serves as an important platform to raise public awareness about voluntary blood donation, inspire regular giving, and highlight the profound life-saving impact of every donor's action. This year's theme, Give Blood, Give Hope, Together We Can Save Lives, reminds us that every donation is an act of hope, restoring life and dignity to patients in need. Madam Chair, safe blood is fundamental to an effective healthcare system. It is not merely a medical need, it is a human right. Evidence shows that regular voluntary and situation remains challenging. Against the target of 10 donations per 1,000 people, Ghana currently achieves only 6 per 1,000. This shortfall leads to delays for patients who urgently need transfusions, and presently, only 40% of our blood supply comes from voluntary donors, and just 36% of these are regular donors. The remaining 60 arrive from family replacement donations, a practice that often masks compensated donation and compromises both adequacy and safety. Our blood collection index of 6.1 remains below the WHO recommended minimum of 10, underscoring the urgent need for improvement. Blood is perishable, with whole blood lasting only 35 days, making year-round donation very essential. Our annual target of 308,000 units is attainable if 1 to 2% of Ghanaians embrace blood donation as a civic responsibility. Our pause here to make a plea to new and old donors alike. The need for blood is constant. The impact is profound. Donate blood. A patient's life in our major hospitals across Ghana is resting on a fraction of hope. Your gift of blood makes all the difference. For those unable to donate physically, advocacy, awareness creation, and institutional support are equally vital. Madam Chairperson, allow me to extend my heartfelt appreciation to the Rotary Clubs of Accra and Accra Range, whose unwavering support over the past 25 years have been central to sustaining our national voluntary blood donation effort. Your long-term partnership continues to inspire our donors and strengthen our program. I also wish to acknowledge the National Theatre of Ghana, the Welcome Group of Companies, Members Church of God International, the Grand Lodge of Ghana, and Care Connect Worldwide Solutions for their invaluable support towards this year's celebration. Your contributions have significantly enriched the 25th anniversary program and enhanced our collective efforts to promote voluntary blood donation nationwide. We further appreciate our voluntary donor groups, corporate organizations, educational institutions, faith-based bodies, the media, and individuals whose dedication, both visible and behind the scenes, ensures the availability of safe blood whenever needed. Today, we also celebrate our award recipients, our remarkable voluntary donors and partner institutions whose commitment to humanity embodies the highest ideals of service. Today, we don't just celebrate 25 years of the National Blood Donor Day. We celebrate 25 years of humanity at its best. In the simple act of rolling up your sleeves, you, our voluntary donors, have rewritten countless stories from endings to new beginnings. You have given mothers time with their children. You have given cancer patients the strength to fight and accident victims a second chance at life. You are the unsung heroes of our healthcare system, and today's event is dedicated to honoring you. With deep appreciation and joy, I warmly welcome you once again to the 25th National Blood Donor Day celebration. celebration and the launch of the 2026 annual blood donation campaign. Your presence lends meaning and significance to this milestone event. Thank you, and may you be abundantly blessed. Let us enjoy this memorable celebration together. Thank you and welcome once again.
To give us some praise. Let's clap for you. Please take your seats.
Honorable Deputy Minister for Health, District Governor, members, senior members of the PDG, and our DG, Jack Oche, and standard law protocols, wish to welcome all of you to the 25th Blood Donors Day lunch as we have here today. Rotary Club of Accra actually goes way back beyond 25 years. Rotary Club of Accra has been involved with blood donation for the last 50 plus years. And we've been ensuring that we do it and try and help the National Blood Service meet their targets. In the recent past, Rotary Club of Accra Ridge have also joined us, and they are helping us get what we need to do. There is a need for blood donation. Like previous speakers have said, blood is life. So when we celebrate our donors, our voluntary donors, we encourage them to give blood and also give encouragement to the other people or other citizens to also get involved in blood donation. Launching the blood donation campaign is not enough. So as Rotary clubs and as a district, we are looking at expanding this and making it a year-long activity where we will try and organize major blood donation campaigns in all the regions if possible. We're working on this and we hope that we'll be able to achieve it this year. If not this year, it is a project that we have in mind to do. We need to do this because, like the CEO said, the yearly target is 308,000 units. The National Blood Service is able to achieve only about 200,000 units. And so there is a shortfall of 180,000 every year. And we need to make it up. So we will roll out a program to ensure that we go to all the regions and get blood donation coming up. So we hope that our major sponsors will also partner us as we try and do this nationwide. To be able to do this, we have partners and supporters. I know that a lot of our partners have been recognized with the various meetings that have come up, but within the Rotary Club of Accra, we also have people who support us, and I think that it's appropriate that we acknowledge them at this point. They sponsor some of the prizes for the winners, and they also give us money to get other prizes for the winners. So I'll take this opportunity to recognize PDG Robert Tata, who has been sponsoring us. BP Juliet Twaki, who has been sponsoring